So I'm sure you remember we had a really interesting discussion yesterday on how to help employees and staff build their careers in local government. I'm absolutely delighted now to be joined by Pat, Josh and Gerald, and what we're going to be talking about today is work on how health departments can share employees and skills to get better use out of those employees and also to empower those people. Well, gentlemen, first of all, thank you very much indeed for taking the time to talk to us today. We very much appreciate it. So, Pat, can we kick off? Tell us a little bit about the work that you're doing in the healthcare area.
Sure. I'm working with the Center for Sharing Public Health Services. It's a Robert Wood Johnson national initiative, and it generated from the belief that, particularly as public health is facing both shortages in resources and at the same time an increase in performance expectations and standards, why aren't more jurisdictions, local health departments, sharing their assets and resources? So we've begun doing a lot of work in understanding how these things work, providing assistance in the field, and we have found over time consistently that staffing issues seem to lend themselves to shared arrangements, resulting oftentimes in improvements in capabilities, expertise, and the ability to have a presence that might not have been done otherwise. We've been working with ICMA and through them with the Center for State and Local Government Excellence and found them to be a good partner, particularly to dig deeper into the issue of shared staffing.
Well, let's talk about that partnership a little bit, Josh. So what are the ramifications for this work more generally in local government?
Well, one of the reasons why our Center for State and Local Government Excellence was so excited to work with Pat's group was the fact that, when you step back and you look at it, you're seeing governments trying to provide these services in an adequate fashion amongst constrained resources and limited overall constraints. At the same time, they're having a hard time recruiting and retaining folks, given the underlying demographic transformation that a lot of states and localities are dealing with increased retirements, increased competition with the private sector, and we really saw that focusing on a series of case studies, especially in the public health arena where you have specialized skill sets, high skill sets in demand, not only in the public sector but with their private sector nonprofit counterparts. We really thought that these case studies would show some really nice lessons learned for innovative ways to approach shared staffing that could be replicable not only in the local public health arena, but more broadly in the general local government arena as well.
And it's good for staff development as well, isn't it? It's a more interesting job, isn't it?
No, you're right. You're exactly
Definitely.
right.
It is, and the jurisdictions that we've looked at in Massachusetts, Iowa, Oregon, they've run the range from being large metropolitan areas to very small rural counties and New England towns. It doesn't matter what size jurisdiction. They all have needs which in some cases are bare bones operations, just a couple of staff people. And to be able to have, let's say, an infectious disease specialist or a dietitian or maternal child health specialist is very difficult for one small jurisdiction to do.
Sure.
But partnering in an area that's really not competitive can be very effective. It's not a matter of economic development, it's a matter of disease control and planning, and they're working very effectively together.
Let's pick up, you've got a report coming out in November, haven't you? Tell us a little bit about that, Joe.
Yes, we've been doing interviews with the officials in the Multnomah County, Portland, Oregon area, with a series of actually 15 counties, very small rural counties in Iowa, who are sharing nurses and other health specialists, and in 2 communities in Massachusetts and in Melrose and Wakefield, they have figured out how to share some of their health inspector services. The Iowa jurisdictions are sharing just about everything, and it's not necessarily just the fact that the staff are being shared. They've worked out a way that the HR and the financial considerations are shared as well, and that at the same time it's not a consolidation of services. It's not to say that we're going to have one huge health department. They continue to have their own health department board, and they continue to have the ability to contract or decide not to contract every year as they consider their budget.
And I just wanted to add one other thing as well, is that we found that this shared serving arrangement in a lot of these environments also made them more competitive for state grants, for federal grants, and other opportunities that they otherwise wouldn't have access to.
Well, gentlemen, thank you both all very much indeed for joining us today. Really appreciate it. Fascinating stuff. Thank you.
Thank you.
Thank you.
Thanks.